There is a better and more consistent way to perform sleeve gastrectomy. We call it the standard sleeve. It's an anatomy-based approach using a purpose-built Titan SGS stapler. Insert the standard bariatrics conical shape angularis protecting sizing bougie, or any sizing bougie, to serve as the guide for placing the Titan SGS stapler precisely in alignment with the key anatomical landmarks. Insert the Titan SGS stapler into the abdomen. Clamping as you go, manipulate the entire stomach through the stapler, from the fundus to the pylorus region. Respecting the key anatomical landmarks and the sizing bougie, the resulting cut line should be approximately 1 centimeter from the GE junction, 3 centimeters from the incisura angularis, and approximately 4 to 6 centimeters from the pylorus. From the top to the bottom, visualize the full cut line in a single plane. Fire the stapler. The Titan SGS continuously staples the entire length of the intended cut line with a single cartridge, delivering 6 staggered rows of staples in gastric tissue in less than 1 minute. Titan SGS provides confidence that an optimal, secure staple line is forming in gastric tissue, with localized tissue compression zones and larger anvil staple pockets. Titan SGS minimizes the chance of misaligned or malformed staples impacting surgical results. Titan SGS provides innovative longitudinal graduated staple technology. Each successive staple is taller, matching the entire length of the staple line more closely with the actual thickness of the patient's native anatomy. After firing the Titan SGS, the resected stomach falls away and the new stomach rebounds, revealing a more symmetrical and reproducible sleeve pouch anatomy. The curved staple line is a continuous staple line, free from zigzags, overlapping, or poorly formed staples. The Titan SGS enables the surgeon to plan for a more repeatable and reproducible procedure that delivers consistent sleeve pouch anatomy every time. With limited device technology, bariatric surgeons have been able to achieve the ideal tubular surgical sleeve anatomy less than 40% of the time, which can lead to inconsistent outcomes for patients. Now, with a combination of a repeatable technique and the purpose-built Titan SGS stapler technology, achieving a more consistent sleeve pouch anatomy is possible for your patient. Every patient is different, but with the new Titan SGS stapling technology, their procedure doesn't have to be.
Welcome to the Titan SGS training program. This certification training session is intended to provide surgeons with a detailed overview of the use and application of the Titan SGS system prior to use. The following training modules will provide a systematic, detailed description of the functionality of the Titan SGS stapling system to include contraindications, precautions and safety features. The training modules are a series of focused video presentations describing the features and benefits, followed by individual module testing. An 8-question final exam will be conducted at the end of this training program. A 100% passing score will be required for certification. Module 2. Review of the standard power unit, and Titan SGS buttons. In this module we will be reviewing activation of the standard power unit voice prompts, activation of the Titan SGS stapler, and Titan SGS stapler audio prompts. The standard power unit is designed to supply energy to the Titan SGS stapler. The standard power unit is reusable and is located outside the sterile field in the operating room. The standard power unit is designed to only be used with the Titan SGS stapler. The standard power unit alerts the user with audible prompts. Let's review the standard power unit features and voice prompts. The standard power unit consists of the power button, which glows white when the power source is powered on. The device status indicator, which displays the overall status of the Titan SGS stapler. The clamp and firing indicators, which displays the status of the Titan SGS stapler during closure system mode, and firing system mode. The volume buttons, which controls the volume of the audio feedback from the standard power unit. The device connector receptacle, used to attach the Titan SGS stapler to the power unit. The firing progress indicator, which displays the progress of the Titan SGS staple firing. To set up the system, plug in the power unit, and press the power button. The device status indicator will turn red, while the standard power unit initializes. When the system is ready, the device status indicator will turn green. If no Titan SGS stapler is plugged into the standard power unit, the system will say,
"System ready. Waiting for device."
A Titan SGS stapler may then be plugged into the cable input by aligning the arrows on the end of the cable, with the arrow on the cable input on the box. The device status indicator will turn red while the standard power unit reinitializes. When the system is ready, the device status indicator and clamp mode LED will turn green. The system will say,
"System ready. Closure system mode."
If a Titan SGS stapler, which has already been fired, is connected to the standard power unit, the device status indicator will turn red as the system reinitializes, then begin to blink red while the system says,
"Error. Titan SGS has already been fired. Please replace device."
The Titan SGS handle has 3 simple buttons: trigger up, trigger down, and safety button. There is a safety button on both sides of the Titan SGS handle. To activate the safety button, either side may be depressed. This is the trigger up button. In closure system mode, it opens the jaws of the device. This the trigger down button. In closure system mode, it closes the jaws of the device. This is the safety button. In closure system mode, if the safety button is pressed when the jaws of the clamp are closed, the device enters timeout mode. In timeout mode, the device will prompt the user to look for various suboptimal tissue conditions, before continuing to the firing mode. Once the prompt has completed, press the safety button to enter firing mode. In firing mode, if the device has not begun firing, the device re-enters closure system mode, when the safety button is pressed. In firing mode, if the device has not begun firing, the device re-enters closure system mode, and opens, when the trigger up button is pressed. In firing mode, the device fires, when the trigger down button is held. Once firing has begun, you cannot return to closure system mode until firing is complete. The device will fire automatically if the trigger down button and safety button are pressed simultaneously. The user may then release the buttons. You can exit automatic firing mode and pause the firing motor by pressing any button during the firing process. When firing is complete, the device will return to closure system mode. Module 3. Normal Titan SGS operation and firing sequence. In this module we will focus on the actual firing sequence of the Titan SGS stapler, the audio and visual prompts associated with the firing sequence, review of the timeout mode, review of the no tissue zone, and steps for manual and auto firing modes. Open the device by holding the trigger up button until the device says,
"Device open."
Carefully position stomach tissue in the jaws of the device. Close the device by holding the trigger down button until the device says,
"Device closed."
When the device jaws are fully closed, the safety button will begin flashing. Press the safety button to enter timeout mode. The safety button will begin to flash rapidly, and device will say,
"Timeout. Check jaws to ensure there are no tissue folds, no tissue is present in the no tissue zone, and no unintended objects are clamped in the jaws." Press safety button to acknowledge and enter firing mode. Device ready to fire.
After inspecting the tissue, proceed to firing mode by pressing the safety button, or readjust the tissue by pressing the trigger up button. To return to closure system mode. In firing mode, the safety button will turn solid green. To readjust tissue before firing begins, return to closure system mode by pressing the trigger up or safety button. To begin firing, hold the trigger down button in firing mode. Clamp tissue will be stapled and resected from the distal to the proximal end of the device. To enter automatic firing mode, press the safety button while holding the trigger down button. Both buttons can now be released. To exit automatic firing mode and pause the firing motor, press any button. As the device is firing, a visual and audio prompt will update the user on the percentage of firing completion. When firing is complete, the device will re-enter closure system mode. Open the device by holding the trigger up button until the device says
Device open.
Remove the stomach tissue remnant from the jaws of the device. Close the device by holding the trigger down button until the device says
Device closed.
Remove the device through the trocar. Module 4. Cycle interruption and manual bailout. In this module we will address what to do in the event of a sudden loss of power during the stapling process. What to do in the event of a high load warning. What to do in the event of a device malfunction. Location and function of the bailout key. Removal of the motor pack. Manual reset of the knife. And manual opening and closing of the jaws. In the event of a sudden loss of power to the operating room, the standard power unit will reinitialize. If the device has been fired, the standard power unit, device status indicator, will blink red, and say,
Error. Titan SGS has already been fired. Please replace device.
If the device has been partially fired, and needs to be removed from the tissue, follow the manual bailout procedure. What to do in the event of a high load warning. The Titan SGS includes safety features designed to warn the user of a high load on the closure and firing motors. In the event that a high load is detected, while opening the jaws of the device, such as accidentally opening while inside of the trocar cannula, the standard power unit, device status indicator, will blink yellow, and say,
Warning, high load detected. Please inspect Titan jaws before proceeding. Close jaws to continue.
Press trigger down to acknowledge the warning, and continue using the device. The device status light will turn green. In the event that a high load is detected, while closing the jaws of the device, such as accidentally closing on graspers, the standard power unit, device status indicator, will blink yellow, and say,
Warning, high load detected. Please inspect Titan jaws before proceeding. Open jaws to continue.
Press trigger up to acknowledge the warning, and continue using the device. The standard power unit, device status indicator will turn green. In the event that a high load is detected, while firing the device, the standard power unit, device status indicator, will blink yellow, and say,
Warning. High load detected. Please inspect Titan jaws before proceeding. Hold trigger down to continue firing.
Hold trigger down to acknowledge the warning, and continue firing. The standard power unit, device status indicator, will turn green. What to do in the event of a device malfunction. The Titan SGS includes a safety feature designed to prevent damage to the device. This safety feature will trigger in the event that the load on the closure or firing motor passes a critical threshold. The standard power unit, device status indicator, will blink red, and say,
Error, device failure. Please engage manual bailout.
Location and function of the bailout key. The Titan SGS Stapler has a mechanical bailout safety feature, to be used in the event of a device malfunction, or loss of power. 1. Black bailout key comes with each Titan SGS device. The bailout feature allows the user to mechanically return the knife to the distal end of the device, and to open and close the stapler jaws. To operate the manual bailout system, remove the rear portion of the handle by depressing the two tabs on either side of the Titan SGS handle. First, return the knife to the distal end of the device by inserting the bailout key into the black lower receptacle. Insert the key and rotate the key counterclockwise. Rotate the key until you feel resistance rise significantly. You will also see the knife return to its starting position when the knife is fully returned. Next, open the jaws of the device By inserting the same bailout key into the upper, metal receptacle, insert the key, and rotate the key, counterclockwise, to open the device jaws. Remove the tissue from the jaws of the device, and rotate the key clockwise, to fully close the device jaws. This will facilitate the removal of the Titan SGS stapler through the trocar. It is important to understand, the bailout system is specifically designed to ensure that the surgeon is able to remove the device from the patient, even in the event of a device malfunction or loss of power. The bailout key cannot be used to finish the stapling process. Module 5. Contraindications of use, precautions, and safety features. Contraindications. Do not use the Titan SGS stapler on the aorta or other large blood vessels. Do not use the Titan SGS stapler on tissues that are necrotic, friable, or have scar tissue or altered integrity, such as ischemic or edematous tissue. Do not use the Titan SGS stapler on patients that have had prior gastric surgery in the area where the stapler will be utilized. Do not use the Titan SGS stapler on bowel or solid organs. Do not use the Titan SGS stapler on major vessels. Evaluate tissue thickness carefully before firing any stapler. This instrument is not intended for use when surgical stapling is contraindicated. Use on tissue easily compressible to the labeled closed staple height. For ease of reference, the closed staple height is printed on the top of the anvil, as well as described in the instructions for use. Precautions. Before using the Titan SGS stapler, remove the red-colored staple retaining cap, and observe the surface of the cartridge. If any yellow-colored drivers are visible, do not use as staples may be missing. During insertion into, and removal from the peritoneal cavity, the Titan SGS stapler must be fully closed. Open jaws will cause difficult insertion, or withdrawal of the instrument, and may result in damage to the instrument, or patient injury. Use caution when closing the Titan SGS stapler jaws on tissue. Ensure there is no tissue in the no tissue zone of the stapler, i.e. the proximal end of the stapler jaws. Closing on tissue in the no tissue zone may result in tissue damage. Stapling tissue in this area of the device may result in tissue being transected without staples. Ensure that the tissue is flat, and positioned properly between the jaws prior to closure. Bunching of tissue along the length of the jaws may lead to an incomplete staple line. The device jaws will not close on tissue too thick for stapling. If the jaws do not close, do not use the Titan SGS stapler. When stapling any tissue, careful consideration should be given to existing pathologic conditions, as well as any pre-surgical treatment, such as radiotherapy, that the patient may have undergone. Do not partially fire the instrument. Incomplete firing can result in malformed staples, incomplete cut line, bleeding, and leakage from staple line, and/or difficulty removing the instrument. If the clamping mechanism becomes inoperative, and the jaws do not clamp on tissue, do not fire the instrument. Remove, and do not continue to use the instrument. If the firing mechanism becomes inoperative, do not continue to use the instrument. If the device becomes inoperative during use, the device can be manually operated, by removing the motor unit, and using the bailout chuck. Before removing the instrument, be sure tissue is cleared from the jaws, and then close the jaws. After removing the instrument, examine staple line for pneumostasis, hemostasis, and proper staple closure. Minor bleeding can be controlled with manual sutures, or other appropriate techniques. Certain conditions, or preoperative treatments may cause changes in tissue thickness that would exceed the indicated range of tissue thicknesses for the Titan SGS stapler. Minimally invasive procedures should be performed only by persons having adequate training and familiarity with minimally invasive techniques. Consult medical literature relative to techniques, complications, and hazards prior to performance of any minimally invasive procedure. When using other technologies, for example electrocautery, in the procedure, observe precautions of the original equipment manufacturer to avoid the hazards associated with their use. Safety features. Safety features in the clamping subsystem were added to the Titan SGS stapler based on risk management and usability testing. Two important safety features are the implementation of soft and hard motor limits. The soft motor limits are designed to provide feedback to the user when abnormally high loads are detected, while opening, or closing the jaws. For example, it attempts to open the device, while obstructed by the trocar, i.e. the device jaws remain partially within the trocar, or if the device is closed on abnormally thick tissue or folded tissue. The hard motor limits are designed to prevent the user from stressing the mechanical system of the device to a point when mechanical failure may occur, which would render the device unusable. If a hard limit is encountered, the device will not fire, and the user will be prompted to remove the device. For example, if the user attempts to staple through the sizing bougie. Module 6. In this module we will be reviewing the standard trocar indications for use, components, and steps of proper use. Standard trocar. Indications for use. The standard trocar is a sterile, single-use device consisting of an obturator, a cannula, a 5 mm adapter and introducer sheath. This system is indicated for use in general, and abdominal, minimally invasive, surgical procedures to establish a path of entry, or to gain access, through tissue planes, and/or potential spaces for endoscopic instruments. The standard trocar consists of a cannula, obturator, 5 mm adapter, and introducer sheath. Carefully insert the trocar with direct laparoscopic visualization. Remove the obturator by depressing the finger tabs on the side of the obturator cap, and carefully pull the obturator out of the cannula. Carefully insert the end of the Titan SGS stapler into the introducer sheath, and slide the sheath back, until the red band on the Titan stapler can be seen through the sheath. Insert the Titan SGS stapler with preloaded introducer sheath into the trocar cannula. To prevent loss of insufflation during insertion of the Titan SGS stapler, do not move the introducer sheath forward until Titan SGS stapler is fully inserted into the trocar cannula. Once ready to remove the Titan SGS stapler, pull up the introducer sheath hub back until the red band on the Titan SGS stapler can be seen through the sheath. Then pull out the Titan SGS stapler and introducer sheath simultaneously from the trocar cannula to avoid loss of insufflation. Remove the trocar cannula from the patient and close the surgical defect accordingly.